ballpark figure, and also has made some adjustments as well. We gave each one of you that yesterday. Today, what I'd like to do is have Senator Melton, um, before we get started with the public hearing, to walk through the changes that are in the one bill that you have in front of you that he's going to offer as a substitute, and go through that. Once we do that, we will do our public hearing. And then we're going to talk about the bill, add, take away, whatever amendments that are placed on or taken off of as a single bill. But I want to pass the substitute up or down that you're bringing today after you explain that. That way we'll have a bill that we can debate rather than all these amendments that is very challenging to work through as a member. So Senator Melton, SB 46, if you will, talk about the bill, the changes that you have accepted in your substitute from judicial, and any other changes.
Okay. If you look, you'll have a summary sheet as well of the changes that legislative service did. I'd like to commend, before we start, Paula Green. Paula with legislative service has been just awesome working with y'all and me and everybody else. And thank you again for all your time. I say it privately a lot, but I'd like to say it publicly. Thank you very much. The First Amendment requires the medical cannabis to accept and consider public comments for a 30-day period prior to issuing any license. I thought that was great. Transparency allows for public input. So I think that that's a good amendment that we accepted. Amendment 2, deleted reciprocity. We have had the idea that people from other states, if they came and did not have their medicine and stayed longer than their supply, that we would allow them to come and get a one-time per year. But we took that out simply because of the Commerce Clause and other things. So we deleted reciprocity. We did accept also Amendment 3, which adds to the Medical Cannabis Commission one appointee from the state health officer. That was kind of a compromise. Some individuals wanted the state Department of Public Health to run the program, and they were not set up, nor did they desire to run it. And the current commission is a very diverse group with individuals such as everything from farmers to lawyers to the qualified people to make have input, also workforce people. Amendment 7, we just altered the caregiver to give it a little more tightness. It's kind of a fine line in Alabama. You know, if you have a child at a certain age, you become, I don't know if the word would be emancipated, but you become the age of majority. And so, but we worked that out, and it just kind of clarifies the caregiver. Amendment 8, which was also allows the counties and municipalities to ban dispensary. We just said, hey, if you don't want one, that's fine. I personally believe if we pass this, that most communities will want it as an alternative. The 9 just kind of cleaned up. Let's legislative findings be brought out. Majority of ownership. It just kind of did things like requirements, 15 years, cultivator integrity license. It just cleaned up the pathways, whether it's an integrated or non-integrated pathway. Amendment 10 just kind of opens up the disclosure for the applicant to make sure that we know who the characters are and what their background is, and to make sure they're you know, qualified and able, and also no history of deviant behavior or whatever we want to call it. So those are the amendments. We did also change the qualifying medical conditions. I knew some people had heartburn with anxiety. We took that out. We did include, at the last committee's request, depression and Parkinson's disease. You know, the study that came out with depression showed that with serotonin uptake reinhibitors, that if you put them on medical cannabis for 2 weeks, it allows their level to build up. And that particular study that they did show that almost 100% of suicidal ideation went away in 6 hours. So it was a pretty impressive study. You take them off after a certain period of time and just keep them on their medication. Also going to put another member from the AG's office and Aaliyah We also did the revolving door for people who, if they come off the commission or if they have an economic interest, that something changes that we need to rotate them off or get them on. Also, we put in there that the Department of Ag will make sure that the good manufacturing practices are followed on the cannabis production. When you think about producing this sort of thing, the little things that are important for the patient's safety would be like a lot date in case there's an issue with the quality, expiration date, lot numbers. If you're this equipment, the little things you don't think about. Is it a petroleum-based lubricant or a food grade lubricant on the machine? You obviously want a food grade. So that sort of thing is important in the production of this. Also, I mentioned before, Leah came to me and wants to be involved in the compliance aspect. So we put in there a MOU with the law enforcement agencies to enforce the licensing provisions. And again, put a definition of economic interest in there for consistency throughout the bill. And again, another one explicitly states which individuals will qualify as an applicant because of a criminal conviction. So again, that goes to the background check. We did the revision of the total number of cultivator licenses that will be no more than 12. And then we also put the access to pharmacists to the data bank. Initially, the amendment said they would have access to seed to sales. And we didn't think the seed to sales was important. What was important to know that they were on it. So they could just go to the data bank and then they could look and see if they're on it. So for drug interactions, any type of reaction that or interaction that might be an issue, as well as to see if they're on other medications that might be suspicious to have them on, so to speak. And that's pretty much the changes there. Did you want me to stop there or?
Yes, if those are the changes that have been made, including the amendments
Yes.
That were done in Judy, and as well as the tweaks that you have.
Yes, just some cleanup tweaks and some corrections. And like the Leah thing was not brought up in judiciary, but it was obviously important to get that in there, and also the Department of Ag.
Okay, I would ask any of the members, if you have any question, you've had this in your hand now for a while. So if you have any questions, on this, to get this to a one form document that we can work from this point. Yes, Representative Hall.
Thank you, Mr. Chair. Thank you, Senator Melson, for your work. Could you talk a little bit about the good manufacturing practices in terms of what do you envision, or what does that look like?
Well, that's an industry term to make sure that it's done to meet certain standards. So the product produced is, patient or pharmaceutical grade. So it's just to put in there to quality control. That's an industry term.
Right. Okay. Well, all right. Thank you.
Yes, sir. Representative Soros.
Senator, this last one, it adds pharmacists to the list that may access the registry. Are pharmacists going to be involved in the dispensing of this drug?
We hopefully will eventually. This looks like it's coming faster than we know from Washington eventually, and we would hope to go to the pharmacist aspect down the road. But until then, no. But they will be able to check the database just for patient safety.
Okay.
I would love to have them involved, and they would like to be involved, but it's not legal at that point.
Thank you.
Representative Meadows.
Will that database correlate their current medications with whatever? Would the pharmacy be able to see any interactions between, like, if they're already currently taking an opiate or something like that? Would it show?
Well, that will be in a database as well. I mean, there's an opioid database.
Would those databases overlap? I guess that's my question.
Well, they'll have access to both. I don't think they will be set up to go, you're on both of those at the same time.
So the pharmacist would have to look at both and say, okay, you're already taking something over here, and now you're taking this, and it really might be over-treating.
Yes, but now the physician
That's
who,
not really the pharmacist's job. That should be the physician.
correct. But as we know that people
Go from doctor to doctor.
yes. So this allows them a way to check the data bank, and they go to pharmacy too. So
Another question, Mr. Chair.
I'm sorry, Representative Hall.
Thank you. Senator Mills, how did you come up with determine the number 12 for the number of license for the cultivators?
We we looked at what the supply and the demand, it's a fine line. We extrapolated from other states and our population and determined we'd probably have about 220,000 patients roughly that would qualify in the whole state. So we wanted to make sure that we had a match between supply and demand.
Thank you.
Yes, Representative Kitchen.
I want to go back a little bit of a follow-up on the good manufacturing question that was asked earlier. You and I have talked, I appreciate you being willing to talk to me in advance, but you and I talked about some of the issues and particularly the edibles where the THC is not evenly distributed. If you buy a packet where there may be more THC in one edible, lozenge, whatever you want to call it. So would this fall under that? Would they be monitoring through the good manufacturing? Would they be monitoring to make sure that the correct dosage is there in every individual dose that they are receiving? If they were to buy, say, 10 in a pack, that they would be receiving the exact amount of THC?
You said every single dose. I don't think that would be probably practical. I think they would do a random check periodically for consistency, but obviously you couldn't check every whatever the mechanism was for delivery. But my understanding is it's pretty consistent and reputable people to have a consistent dose. At least that's what I've been told throughout other states.
Okay.
But it's more when you get to the recreational where people don't seem to worry about the quality.
Okay, thanks.
Any other questions concerning this substitute? And once we get this substitute, if it passes, then we can directly ask questions about the substitute or feel more inclined to do that. I'm looking for a motion for adoption of the substitute.
I move.
Representative Gray makes a motion. Representative Hall seconds the motion. All those in favor for the substitution of this by saying aye.
Aye.
Those against by nay.
Nay.
Amendment or substitute passes. Okay, now we're going to move into the public hearing, Senator Melton. Yes, we'll come back to you. Just a few rules. I would ask that everyone please turn their cell phones off. We're going to take our time, and we're not going to get bogged down here, and we're going to be diligent. We're going to I have actually 10 that will be speaking. Let's see, there'll be 6 against, 4 in favor, and I'm going to go back and forth to cover that. Yes, sir. Okay. All right. Well, you changed my batting line up here then, so let me give me 1 minute, guys. Okay. All right. What we're going to do is we're going to have 3 minutes per speaker, and if you've been in our committee before, you'll know you'll have 3 minutes. If you're in the middle of a sentence, we're going to cut you off, or I will cut you off, whether you're for or against. So I think that that's appropriate to do. And the first speaker, here, I'm going to give this to you. You can have them numbered. And I would ask that you give your name, who you're with, or your affiliation, or who you're with, and where you're from. Okay?
Christine Carr. Good morning. I am Christine Carr. I'm a certified registered nurse anesthetist. I'm coming to you as a private citizen. I'm not going to represent any official organization or where I work. It is at a large academic medical center in the Birmingham area. I am from Pelham, Alabama. And I have a lot of experience in trauma, anesthesia, general anesthesia, regional anesthesia, pain specialists. I do this every day. And this is how medical professionals show our compassion through accuracy, depth of knowledge, preparation for emergencies and adverse effects, the self-discipline to maintain focus and vigilance for our patient, humility and patience to show love to a suffering patient, and even the bulldoggedness to stand up to any pressure that may attempt to shortcut best practices. This is compassion. I've seen it, I've lived it, and I give it every day. What's the result? A patient first attitude. And that's why I'm here, still fighting for patients. And SB 46 is not compassion. This current bill is a business plan designed as a healthcare bill, and it is full with inaccuracies, faulty knowledge base, bad policies that will increase risk of health and public safety, while it places profit before the patient. The result? A dangerous bill that is anti-science, anti-medicine, anti-patient, and anti-compassion. Thank you for the time today so we can deal with real facts and not pop culture misconceptions. A few facts, if I have the time to get them out. A misnomer is that marijuana is proven to help with pain. It does not. There are no actual credible scientific evidence that marijuana is profound with pain. You actually have found in states that we have increased use, abuse, and deaths from opiates. Where there is weed, opiates you'll need. Marijuana is more than just a gateway drug. It is a biochemical slave master. We cannot have it in our state. Marijuana is the #1 substance that increases the risk of completed teen suicides, completed teen psychoses, and depression. In Texas, it was found that marijuana was the #1 substance that related to the deaths of children that died from a neglect or abuse. Landmark Canadian studies and various other studies show that any marijuana given in utero, and even to men that have children in the future, you have an increased risk of autism, depression, psychoses starting as early as age 10, and behavioral issues. We cannot have this exposed to our children, which it will happen if this bill passes. The American Heart Association says no. It increases cardiac death, sudden death, cardiac attack, and stroke. It is an inflammatory process that harms the heart cells. Mental illness increases significantly. It increases depression, anxiety, successful suicides, amotivational syndrome, and violent psychotic episodes, especially when given to teenagers and male teenagers especially. States have consistently found themselves struggling with regulation issues. Oregon just recently did their own audit and found that they cannot honestly say that their products are safe for consumption. Thank you so much. I am available for questions if you have any. Any? Thank you.
Dr. Rollerson?
I believe everybody has my hand out, and I'll take this off to speak. I'm Marcia Rollerson, and thank you, Speaker, for allowing me to be here to talk today, and members of the Health Committee. I'm a pediatrician in Bruton, Alabama. I've been licensed to practice medicine in Alabama since 1979. Medical marijuana laws in 35 states have led to the misconception that marijuana is not harmful, but it is, both in the short term and the long term. It interferes with judgment, concentration, reaction time, and coordination. It is the most prevalent drug detected in motor vehicle crash victims. 2020 results from Colorado, 50% of people in traffic stops are positive for marijuana. It interferes with brain function, memory, attention, and problem solving. Its use in teens has resulted in school dropouts, lowered grade point averages, and increase in college dropouts as well. It's addictive. According to the CDC, the Center for Disease Control, 1 in 10 marijuana users becomes addicted. That number rises to 1 in 6 if they start using before age 18. Marijuana used by mothers during pregnancy can impact their baby's developing brains. It has been linked to problems with attention, memory, problem solving, and behavior problems in their children. Marijuana users are significantly more likely than non-users to develop temporary psychosis, long-lasting mental disorders, including schizophrenia, and it has been linked to depression and anxiety. It's not approved by the FDA, and it's a Schedule I drug. There are 3 or 4 drugs that have been developed that are approved by the FDA that are used for things like uncontrolled seizures in children and nausea in people with cancer or AIDS. The FDA has not approved cannabis for the treatment of any disease or condition except those three things. Lessons from Colorado. Traffic deaths, which drivers tested positive for marijuana since it was approved 20 years ago, has increased by 109%. Marijuana use for age 12 and older increased by 58%, college age 18%. Emergency psychiatric visits related to marijuana increased by 54%. The percent of suicide incidents in which toxicology resulted in positive for marijuana increased from 13% to 23%. Black market marijuana in Colorado has not decreased, it has actually increased. That's true in Illinois. That was just reported a few weeks ago. Marijuana tax revenues are only 1/9 of 1% in Colorado's budget. So it's not a great big tax thing like you think. 64% of local jurisdictions in Colorado have banned medical marijuana.
Time.
One last thing, please. Marijuana is not a medicine. I can't write a prescription for it. A pharmacist cannot fill it.
Thank you. Thank you.
Can I say just one last thing, please?
No, I made a rule that we're going to cut off.
I want to tell about my husband who's a medical examiner, and y'all can ask me that afterwards.
Thank you very much.
Melissa Mullins.
Good morning. I'd like to thank the committee for allowing me to speak here today. My name is Melissa Mullins, and I'm the Executive Administrative Assistant for Alabama Republicans Against.
Pull your mic down a little. There
Better?
you go. Thank you.
Want me to start over?
Yes, we'll start your time.
Okay. Thank you for allowing me to speak here today. My name is Melissa Mullins, and I am the Executive Administrative Assistant for Alabama Republicans Against Marijuana Prohibition. We have been advocating for the sick, suffering, and dying patients of Alabama to have safe access to medical cannabis since 2019. I am also an autism mom, an epilepsy wife, and a multiple autoimmune patient. In July 2020, my husband experienced a very violent and deadly seizure. As I was doing CPR on him to try to keep him alive, our daughter, who is autistic, was standing there watching every twitch and hearing every sound that come out of her father's mouth. Had he been allowed to access to safe cannabis, he nor her would have had to experience that. The legal drugs that he is prescribed affect his every aspect of every day. Most days he is unable to walk without assistance. He has double vision, and extreme heat exposure makes him very sick, leaving him unable to work, provide for his family, or do the things that he loves to do. My daughter is 18 and she is autistic, as I've said before, but she cannot go to a store to shop. What 18-year-old does not like to go to the store and shop for her clothes? She can't, because she can't cope with the loud noises, the bright lights, or the crowds. She's very routine-based, and when that is interrupted, it produces a massive downward spiral of meltdowns and anxiety. If you had asked me 5 years ago if I were a proponent for medical cannabis, I would have said no, absolutely not. But I have seen the tremendous benefit and healing properties of cannabis. From decreasing and eliminating seizures to hearing autism spectrum individuals talk for the first time. Even giving chronic pain patients mobility to be able to get out of the bed every morning just to go make them some breakfast. I have also been asked numerous times if my family's medical conditions are that bad, why don't we just pick up and move to a legal state? I always reply, because I don't want to, and my family shouldn't have to. I shouldn't have to drag my daughter halfway across the country, take her away from her grandparents, the only people that she's ever known other than myself and my husband, just for quality health care. Why do we as a society deem it acceptable to prescribe antidepressants, antipsychotics, pain meds, opioids, and other truly addictive pharmaceuticals in the name of healthcare? but we can't allow something natural and beneficial for the body? Please allow my family and other families in
Time.
Alabama.
Thank you.
Thank you.
Linda Lee.
Good morning, Chairman Lee and other members of the committee. Thank you so much for allowing me to speak today. I'm the Executive Director of the Alabama chapter of the American Academy of Pediatrics, representing 860 pediatricians across the state. I'm going to read our statement on behalf of our leadership. The American Academy of Pediatrics, the Alabama chapter, opposes the legalization of medical marijuana outside of the FDA approval process. Marijuana is not regulated by the FDA, therefore its purity, potency, and consistency cannot be reliably verified, and efficacy as well as risk-benefit analysis are not determined. Though anecdotal accounts have shown that certain cannabinoids could benefit children, such as the lady who just spoke, with specific chronic debilitating diseases, there have been few published studies to date about the effects of cannabinoids in the pediatric population. For this reason, our organization strongly advocates for research and development of pharmaceutical cannabinoids and supports a review of policies promoting research on the medical use of these compounds. Non-FDA approved medical marijuana remains listed as a Schedule I controlled substance. There's no official guidance for pediatricians to follow in recommending marijuana, and they would be in violation of federal law to do so. Currently, there are 4 pharmaceutical grade medications, THC and CBD based, that have been approved by the FDA and are available for physicians to use as clinically indicated. For this reason alone, a law to legalize medical marijuana is unnecessary. And I'll say that our position is informed by the lack of available research, and it is supported by the evidence-based policy and the position of the American Academy of Pediatrics. One example a physician just sent to me through Dr. Rollerson was about he sees approximately 60% of birthing moms at his local hospital up in Florence who test positive at least once during pregnancy. And, you know, the effects of marijuana are neurotoxic to the fetus, child, and adolescent brain. So there's so much more that needs to be studied, especially when it comes to children. And we're just very concerned that this will lead to the slippery slope of more acceptability, and therefore, you know, what that effects of that are on children. So thank you.
Thank you.
This is his anecdote. Yeah.
Laura Live Oak.
Sorry. My name's Laura Live Oak, and I want to show you the picture of this precious child right here. This is my daughter, Marlena Hayes. She was a nurse and was doing the best she could to make a difference in this world. She was killed by an impaired driver. The young man that hit her was underage and was under the influence. She didn't have a chance. Her death was 100% preventable, and we can stop these unnecessary deaths. This is what I see now instead of her precious face when I go to see her. And it's a world of difference, I can promise you, as a mother. And I'm standing here on behalf of mothers and family members that are losing their children or their loved ones unnecessarily. I want to let you know that the concerns of families affected by marijuana, that marijuana is a gateway drug. THC acts specifically on the brain cells, cannabinoid receptors. The highest density of cannabinoid receptors is found in parts of the brain that influence pleasure, memory, thinking, concentration, sensory and time perception, and coordinated movement. Marijuana causes users to experience altered perceptions of mood, impaired conditions, difficulty with thinking and problem solving, disrupting learning and difficulty recollecting memories, and decreased appetite. Because it impairs judgment and coordination, marijuana use contributes to a greater risk of injury or death while driving. Marijuana use more than doubles drivers' risk of being in a car wreck We have medicines that state, do not operate heavy machinery, which also means driving your car while taking medication. So why should we make a drug that has already caused so much tragedy legal? Since marijuana was legalized in California, traffic deaths more than doubled due to the impaired driving by influence of marijuana. I'm here to speak on behalf of families affected by marijuana use. Marijuana is a gateway drug. I live in a county where there is a lot of crime due to marijuana use, and I see families destroyed due to the use. I have a dear friend named Mike Race that does programs for alcohol and marijuana and stuff for the schools, and that's how I met him. I called him Tuesday when I found out that they wanted me to speak here because I knew he had more information on the marijuana and stuff than I do because I've never personally been involved with it. But when I called Mike, he told me that his son had just died Sunday of heroin addiction. When I first met him, I prayed with him that day because I knew there was something about him, that was just different. And he was stressing. He said he didn't know whether his son would be alive when he got home or not.
Time.
Thank you.
I would love to talk to y'all more if y'all would allow me to.
Shay Garrigan.
How are y'all doing? Good morning. My name is Shay Garrigan, and I'm the president of the Alabama Cannabis Industry Association. I want to thank you, House Health Committee Chairman, for Representative Lee, for allowing us to speak here and present these arguments on SB 46. Medical marijuana has shown to have demonstrable medicinal benefits for a number of serious medical conditions. These include severe epileptic seizures, nausea associated with cancer, PTSD, Parkinson, chronic nausea, chronic pain, and more are being added as research trials continue. The Alabama Cannabis Industry Association is in favor of Senate Bill 46, the Compassion Act. Residents of our great state of Alabama should not have to travel outside of the state to receive medical treatment for themselves or their children. 39 states have already legalized medical cannabis. Residents of Alabama are having to leave the state for treatment or break state law. SB 46 tightly regulates medical cannabis and avoids some of the excess that occurred in other states. We applaud Senator Tim Melson for his work in crafting this legislation over the past 3 years. We ask members of the House Health Committee to support this much needed legislation and to bring it forward. Thank you.
Thank you.
Carolyn Tyus.
She's actually in the ER having some medical issues this morning.
Okay.
She's another MAD representative.
Antoine Mortigan.
Good evening, committee. Thank you for giving me the opportunity to get here and speak and be heard today. My name is Antoine Mortigan. I'm a recognized member of Minorities for Medical Marijuana, which is a national organization that encourages the participation of minorities participation in medical marijuana. I'm originally from the west side of Chicago, born and raised. I came down to Alabama in 2009 to advance my education at Alabama A&M University. I studied in electrical engineering. Upon graduating, I decided to stay in the state. I decided to reinvest in the state that offered me opportunities to build a professional career. I am also a farmer in this great state. I ask that this committee to support this bill that offers great opportunity to the residents of Alabama. The state of Alabama have excellent and experienced farmers to be able to produce the best product, the best quality of product that could. I ask that the committee to support the bill that offers great opportunities for the residents of Alabama. The state of Alabama has excellent experienced farmers that have the ability to produce the best products to the state and collaborate to ensure that the best product is produced. I ask that we ensure that the commission commits and stay committed to the support of making sure that the committee, the Medical Cannabis Commission is diverse. And I will also ask that we uphold the 25% license for the members for the underserved community. This bill has the opportunity to create a win-win situation for the state and also for its residents. This bill has the potential to do a lot of good for the state. The economical stimulus from this bill has the potential to create jobs that the well-deserved Alabamans deserve. This medical bill has an opportunity to lift all Alabamans in all communities. And I would like to speak from a personal aspect. I'm originally from Chicago, Illinois, and Chicago, Illinois had legalized medical marijuana years ago before I even knew. But my auntie, she was a victim of breast cancer, and she ended up beating it the first time with the use of medical marijuana. She was able to live an awesome decade that I didn't even know that she had this illness, but ultimately the breast cancer ended up coming back and ultimately ended up taking her life. Then I also have a mother that also dealt with breast cancer, and she was anti-medical, she was anti-marijuana. But after she was diagnosed with the breast cancer, she started to do more research and enlighten herself and was able to debunk the theories and the things that she thought about medical marijuana. So she was able to take a natural step to be able to correct her health, and she was able to ultimately beat breast cancer. And that's all I have to say. Thank you.
Thank you.
Joe Dalton. Okay, that's it.
Okay. All right. Senator Melton. Now is where the work begins.
Can I, Mr. Chairman,
Yes, sir.
can I make a few comments to some of those statements, or did you rather me?
No, you go ahead. That'd be fine.
You know, the pediatrics statements, I would agree with most of them. It has no place in the pediatric population, and unless it's pretty desperate. And matter of fact, the person representing AAP, you know, their own policy national says that they oppose medical marijuana outside the regulatory process of the U.S. Food and Drug Administration. But the next line says, notwithstanding this opposition to the use, AAP recognized that marijuana may currently be an option for cannabinoid administration for children with life-threatening or severe debilitating conditions for which there's no current therapies are adequate or are inadequate rather. So my bill does exactly that. It doesn't recommend it for in pediatrics except for the conditions, and that would be up to the pediatrician. You heard some members say that it needs to go through the FDA process. I would agree with that, and hopefully eventually it will. But you know, some of these people that spoke that it needs to go through the process at the last meeting admitted they jumped to the front of the line to get their vaccine, which has 2 more years to go through the process. And my point on that is, it depends on if your rear end's in a dire situation, whether something needs to go through the process or not. If you're worried about getting COVID, you're not going to worry about that 2-year, 3-year. It's about a 455-day study, and it has over 2 years left. So those people, many of y'all probably took the vaccine, but you know, it's listed as experimental, hadn't been through the trials, and there will be possibility of consequences, but you took the risk and you took it knowing your situation, and it's a preventive measure. So it's not necessarily, you had a 99.997% surviving that, but you jumped to the line to get that vaccine because you want to make sure you're covered. This is just the opposite. This is a treatment bill. You're going to have this problem. You're going to have tried everything else. And then when it comes to the point you tried everything else and nothing else worked, we're just going to give you the opportunity to go to something that might work. I think Alan Shackelford out in Colorado said it best when he said this isn't a miracle drug, but in people that's tried everything else, it can do miracles. You know, it's not a cure-all, beat-all. And I would agree with, like I said, a lot of what they said. One thing I heard was that opioid deaths have gone up. There's actually a new study that showed out this is recreational, and I'm not for recreational, but an increased dispensaries goes directly in line with or I guess inversely with the number of opioid deaths that a new study came out. If you had 1 dispensary in your neighborhood, it dropped so much. 2 dispensaries, it dropped even more. And 3, it dropped like 30% in overdose deaths. And that was a new study that just came out. So there's some contradiction here. Oregon showed that ages 6th grade through 10th grade, the admission for marijuana overdoses has dropped over 20% in that state. I'm not for recreational. I'm just saying you know, we keep some of this data conflicts because it's not medical, it's recreational. You know, I'm so sorry about the lady's loss, but I assure you that young man that hit her and took her daughter's life in a tragic way, he didn't have a medical card. He didn't get that prescription or recommendation from a doctor. And he probably was way above the level that you'll see with anybody that takes this. So I just wanted to make those comments, and I want to do it right. I heard, you know, another gentleman say that people are going to make a lot of money off this. I don't care. I don't care if people get billionaires off this drug. I don't care. I just want to see it get to the patients that need it. I want to see people get relief. I want to see them not have to leave the state to try something that worked for them. And, you know, I never wrote this bill. Well, when I started this journey, I knew nobody that was interested in growing it, processing, or doing any of it. I just started studying the articles out of primarily Israel, where the benefits were obvious. You know, you go to a country like Israel, they're so, it's a poor country compared to America. So they put the money into a raw product because it's not going to have to go through a lot of processes. So they did their own studies. You know, it's, the FDA will not, even if they said, hey, we approve these studies, the drug companies are not going to probably go to a lot of expense because there's unless you get an Epidiolex, which isolates something, there's not going to be any money in it. So it's going to be harder to see it go through the FDA process just simply because our way our society's set up, which is, you know, the best way it can be set up in the world as far as I'm concerned, but it does have its drawbacks. And one of it is going through a nonprofit drug to get to FDA process, if that makes sense. I might have scrambled the words there and done a little word salad, but I hope I made my point there.
Okay. I have some comments, some questions. I have some comments or questions that I want to go through, and then others that may, and I believe there are amendments that want to be addressed. And you may have mentioned, but I just want to hear it coming from you. The database, as far as a physician, he has the ability to see that, okay, we've done a lot to keep people from doctor hopping, pharmacy hopping with opioids with the database. We're going to have a same type database with this. I want to confirm that. And
That's
we
correct.
understand that. And the question was asked just a few minutes ago. The physicians will be able to look at both databases and see if they're willing to go to that next step and look. If they have a red flag of any sort, they can look and see, are they jumping from opioid to cannabis or back and forth? They will have that capability.
That's correct.
Okay.
And MASA's going to be responsible for setting that up, so that shouldn't be an issue.
Okay. Explain the process. And I think we all know it, but I want to know the exact process. I go to the physician of what that physician has had to gone through to be able to prescribe or recommend according to the verbs change in this. Then they'll take the script. Tell me step by step of how that will happen.
Well, the individual would have to go to a physician who makes the recommendation. If he's unable or hadn't gone through the education process of getting the license to recommend it, then he would have to refer them to somebody else to recommend it. So the person who actually recommends it has to go through the process of both education and licensing. Then that individual would go to a dispensary and have it filled there. But you know, my initial bill 3 years ago said you had to document that you tried every other modality prior to going to this particular treatment. That wording was taken out, but it's still in there that they have to try other things and they have to have failed. But then they would go and get that and then be followed up.
Okay. And I had all these questions actually on what page and line, but when we did the substitute, that changed all that. So I can't go directly to a line and page. Daily dosage, you have changed that from a number to 50.
Yes, you cannot start out more than 50. Most individuals from other states, like Mayo Clinic has a dosing guideline, and they'll start out a lot lower. But nobody can start out at greater than 50 and then up to 70, go up to 75 after, I believe it's 60 days. And then above 75 daily dose, your license would be suspended. We just put that in there as a safety measure. And then if you're terminal or go above that, that's up to you and the doctor.
Okay. And somewhere around page 54 is talking about marketing, advertising. Clearly, there will be no marketing or no advertising.
No
And-
billboard, for the doctor or the dispensary. There'll be simply be a sign on the building that says, you know, recommendation couldn't be filled here, something similar to that. But there'll be no see Dr. Green and all this sort of garbage you see in other states.
Okay. And I noticed that there are no requirements for any type of camera, 24-hour, 7 days a week camera requirements in there. I'd like to prepare an amendment to, as you're working over there, Ms. Paula, that requires a 24-hour, 7-day surveillance camera in those dispensaries with a 60-day rollover time. So those are required in those. Right now, that's all I have, but we'll come back. All right, the floor is open. Those of you that have any comments, there are several people here that I know have amendments, and now is the appropriate time to address those. I will recognize you, Representative Hall.
I just want to say to Dr. Melson, thank you for staying the course. More than 20 years ago, I brought a bill dealing with medical marijuana. And that bill was based on the fact that I'd recently lost my son to AIDS at the age of 25. And as a mother of a child who only had one type of medication to take, which gave him all types of negative reactions, I started doing the research. So I do understand the message that those individuals that have come before you and come to this group talking about what it feels like and what it looks like to have a state that takes on this issue and address it. Now, does it do everything that we think it should? No. But it certainly is a long ways from what it was 20 years ago. I had one Republican that was on the committee with me that voted with me to help me to get it out of committee, but that was it. That was as far, and because he understood, because he and his children had some challenges. But today, as I sit here, I just think about my son and think that he's probably smiling and saying, there's my mother in the middle of this stuff, trying to help those individuals who have a need for this service. So I want to say thank you.
Thank you. One other thing that Dr. Zavarsky was going to mention today is MASA and UAB ran a poll of 450 physicians, and just short of 70% said they would approve of recommending it. And so I thought that was interesting. And one thing that's kind of ironic is the highest group was the group of pediatricians, and it was 80%. And it also seemed to go hands in hands with the more specialized field where you see more difficult cases, the higher the percentage was that would approve it and support it. Also, Quinnipiac ran a poll. 93% of the public said if it was recommended by a doctor, they would try it. 93%.
Okay, Representative Meadows.
Is this on? I've got some questions, and then I do have an amendment.
Okay.
Do you have any feel for number of patients across the state that if this were approved in the following 12 months would be able to access?
There's a lot of variables as far as setting up just the education component for the prescribers.
Right.
The regulatory and the quality management for the growers and the dispensers. Our processors. I would think that, no, I don't have the answer to that, but is the short answer. But if some of the CBD people convert over, it might be quicker than we thought. But I think 12 months, it might be a little bit ambitious because the commission also has to go through Senate confirmation.
Oh, that's true. Okay, so let me just try to make it a little bit easier. After the whole thing is set up and ready to go in the next, I don't even care what time period, are we thinking hundreds, thousands, or tens of thousands that might qualify for?
Well, again, I mentioned earlier that if you do our population compared to other states, it'd be about 200,000, a little bit over that, that would possibly qualify. That'd mean everybody would get it, and it would be.
Okay, next question. I'm not an attorney, but would state law then supersede federal law that says that this is illegal if if the legislature were to approve it? And I know, I'm aware of however many other states, 37, 35, whatever.
Well, every year the federal government in their budget does a amendment, and the amendment clearly states, and I think it's Robeck or Farr amendment, I can't remember for sure, but the amendment clearly states that no federal money by the Justice Department will be used against medical marijuana, to enforce medical marijuana laws or takedown. Now, that doesn't mean if you're not following the rules that you set up, they might not do something. But if you follow your own rules, it's clearly stating the federal government's every year that they will not come in and bother your, so to speak.
That's what I wanted to hear. And last question, and then I'll bring my amendment. There are 4 drugs that currently have gone through the FDA process.
Mhm.
The FDA has been around for, I believe, over 100 years. Help me understand why we should, as a body here, make a decision to skip that process for the cannabis.
Well, I can tell you that one is time. I mean, the studies aren't being done because a lot of companies don't want to put the money and time and effort into it. Understand that. 2 is, if you look, there are studies out there, that UCLA did a total knee replacement study and gave patients, I believe it was morphine and the other rescue medication. I'm sorry, morphine and placebo versus morphine and cannabis. The patients that got morphine and cannabis used 50% less opioids. So there are studies out there, even though you heard that there aren't, there are studies out there. And there was a recent one that came out from Harvard. I think it came out last week that showed the benefits. If you go to overseas, there's a lot of studies out there that show that it's beneficial. The first reported case of it being beneficial for seizures, I think was in like 1470. There was yeah, it's been around a long time. There's probably been more independent, small-based trials on this drug than any other drug out there. We just hadn't captured a lot of the data. And yes, there's a lot of chance for to do some good. And I do have concerns about, you heard the slippery slope and the gateway. I understand that. That's why this bill's been written as tight as it's been written. And I think if we pass this bill, we get it tight before the federal government just says it's legal and okay, and we have something in place to make sure that we're set up instead of it just becoming the Wild West down the road.
Mr.
Representative Meadows, you had some amendments.
I do have, you want me to do them all at once or just?
Oh, you can, your choice.
Okay.
Go ahead.
The first one I want to bring in was a request from the Board of Medical Examiners.
Now, if you would move the microphone a little closer.
The first one I want to request, there we go, is a request from the Board of Medical Examiners. At the top for the committee, it's LSA 2021-22041, which is about the 3rd or maybe 4th page back. 5th page, if they're all in the same order, which they probably are, aren't they? Maybe. Okay, well, anyway, basically what it does is add a fee for the physicians who are using the registry for an initial registration fee established by the board not to exceed $300, and for continuing years, a renewal fee of not to exceed $200. And that's on page 15, line 7. Is that the
document number is 213133-1 at the top left.
Right?
Okay. Everyone has that in their packet. There are some of these amendments were placed in there today.
But I got this yesterday, but this is the same numbers.
It's the 5th page in the packet.
Right, but it's the same as, does the numbering match? Okay, so it on page 15, line 7, after 2D, insert the following recommending. And then on page 34, after line 20, insert a new subdivision as follows, and renumber the remaining subdivisions accordingly. 3 would say pay an initial registration fee established by the board not to exceed $300. And then on page 35, line 4, after physicians, insert the following, including payment of an annual registration renewal fee not to exceed $200.
Second.
frankly, I was
Okay.
surprised that they wanted to find themselves or feed themselves, but that's reasonable.
Okay, I have a motion by Representative Meadows, second by Representative Hall. Senator Melton, do you have any comments?
No, I'm fine with that amendment.
Okay. Any other comments, questions from the members? All those in favor of this amendment by saying aye.
Aye.
Nay, same. Amendment passes. Here's the first one.
Mr. Chairman,
Yes, sir.
I just got a text from the Department of Public Health. I think there was a flyer or something handout given to y'all that had their, had the Department of Public Health's logo or something on there. They just wanted me to know and let y'all know that they did not approve of that logo
Okay.
being on that statement, and nor do they know about or support that. So
Where'd it come
Huh. Are you ready for my amendment?
Okay. All right, Representative Meadows,
I have an,
you have another one? Amendment.
I have
Representative Hall, you have a comment on what we just did?
No, I'm,
If not, we'll come back to you. Representative Meadows.
I have another amendment. Okay, at the top on the left, it's actually the last page in the package, 213095-1. On page 90, line 12, delete and on page 90, line 13, after the word representatives, insert the following comma and the Attorney General. So this just adds the AG's office to the list of people who get the database research that this bill already
Okay.
provides for.
All right, have a motion by Representative Meadows. Senator, do you have any comments first?
no, I'm fine with that
Okay.
amendment.
Have a motion by Representative Meadows, second by Representative Lipscomb. All those in favor by saying aye.
Aye.
Those against, nay. Amendment passes.
No, just send them away. Doesn't put somebody on the
Okay. Representative Meadows, you have another one?
I have another one, but if the third page in here passes, then mine is moot. So
I'm sorry.
there's an amendment in the packet that I don't know who is planning on bringing, but if that were to pass, then mine is moot. So we probably need to bring that one first, or I don't care.
Okay. Let me come back to Representative Kitchens, I believe has some, but Representative Hall, Representative Meadows, we may come back to you in a moment. Representative Hall, you had a comment?
no,
Okay.
I have an amendment when you're ready.
We're ready. You bring it on.
Thank you. Thank you, Mr. Chair. The amendment number is 213153-1.
Is it in this packet?
Yes, sir. It's page, the next to the last page.
Okay.
And so this amendment on page 89, line 11, after consists of, insert the following: Hudson Alpha for Biotechnology and Southern Research Institute. Also, on that page, include on page 89, line 8, after compose, insert the following: the president of Hudson Alpha Institute for Biotechnology and the chief executive officer of the Southern Research Institute. And on page 89, line 13, delete institution and insert in lieu thereof college and university. And so, Mr. Chair, what this amendment does really provides an opportunity for research to occur. And as a part of that, also it is inclusive of our colleges and universities. I move adoption of the amendment.
Well, let me do a first and a second. Representative Warren makes motion. Representative Gray seconds it. Are there any questions? Okay, Senator, just explain what the difference is here
Well,
for everyone.
this just allowed, I assume this is the Alpha Hudson and
It is.
Southern Research bill that they were intended to be on as far as getting the funds and being able to apply for a request to do the research. So this just makes sure they are included. It's a good amendment, in my opinion.
Any questions, comments? All those in favor by saying aye.
Aye.
Those against, nay. Amendment passes.
Thank you.
Thank you, Representative Hall. Okay. Representative Mooney.
No, we've had a number of people express personal involvements, concerns, situations, and effects to them and their family. And certainly moved by Representative Hall's situation with her son and so forth. As I was listening to testimony, I wanted to go back to Dr. Rawlison for the comments about her husband, who was a medical examiner. Would just like to understand what she was going to tell us from a medical examiner's perspective.
I'd rather not, simply because the way we did it and the 3 minutes, I think it's very important, but I think that at the appropriate time, you'll be able to address each one of us. If I do one, I've got to do 5 or 6, 7 more, and we cannot allow that to happen. Okay.
I did want to tell Representative Hall that there are now 3 approved drugs that are synthetic cannabis for treating AIDS patients.
Representative Mooney, do you have anything else?
No, I mean, I wanted to know about the medical examiner perspective. That was a
Okay, well,
concern.
we should have,
Involves an actual.
we should have started that
process.
in the beginning of the conversation.
I just wasn't able to ask any questions of her, so that's why. There was another as well, but that's perfectly fine. I guess we'll just need to individually.
All right. Other amendments? Representative Kitchen.
And I do have a couple of questions, if that's.
Yes, sir. You
Before I get to the amendments, I want to ask one thing. And you mentioned the COVID vaccine, and I disagree with you a little bit on that, because that is a new disease that's come out. If I counted correctly, there's 16 conditions in this bill. Is that correct? And there may be some amendments that change that, but roughly 15 or 16 that have been around a while. So when you reference the COVID vaccine, that was a new disease that's come out. The 16 conditions have been around a while. So why has the FDA not taken this up? And do you know the answer to that?
I can only give you my opinion. It's like the last Surgeon General said, that it's time to lower, he came out and said no such thing as medical marijuana, and the opponents stopped there. But if you continue to follow what he said, it has medical components in it, and we need to do more research, and the schedule needs to be changed. And that was the previous Surgeon General. And actually, the biggest problem he said with, he continued to say the biggest problem with cannabis in general is racism, and, going into the 4 times more likely to be incarcerated if you're black versus white and all that. So he got a lot further, but everybody likes to stop right there when he says there's no such thing as medical cannabis. That being said, it's a long process. I got asked in 1996 or 7 to do a cannabis for derivative research on study. I do research for a living. Matter of fact, I've done a lot of pediatric studies with opioids. The problem with one of them is like Demerol coming through breast milk. There was a lady, you can be a hyper-converter, a non-converter, and somewhere in between to active metabolites of certain drugs. That being said, is that everybody's different. But back to your question is the fact that there has to be a way to isolate, and they've done this on some of them, but you got to know which components work for what, and they work synergistically. They work for, it's hard to get a patent on a natural compound that's out there. How do you go and get the research proprietary patent for certain components? They're doing that, breaking them down, trying and saying you've heard some of the things, but like I'll just leave this with you for a second. Look at the different components and what they do. It's what they call the entourage effect and the synergistic effect, where they work together. You have natural cannabinoid receptors in your body. Most people don't realize that. When you take CBD, many of those that you have are transmitters or compounds that you're just building up in your own body that have done certain functions, which is like what we do with a lot of drugs. We use something to make them either produce more or destroy less, sort of things like that. The answer is it's got to be profitable. Like I said, If you go over to the Israel and a lot of other those countries with less resources, they're doing the studies right and left. If you ever get a chance to go to Tel Aviv, it's incredible what all research they're doing over there. So you got to look outside just the FDA. You know, FDA is very stringent. I just got audited by them for a project I'm doing, which was a pediatric study, by the way, and no findings, but they bring the hammer down and it's tough. I've also been audited by the European version of the FDA, and they're just as tough. It's a lot of hoops to go through, and a lot of it's got to be worth it. That's why the same thing you see with orphan drugs, you know, orphan diseases, you don't see very many cures because it's not worth it, because the population's needs not out there. It comes back to being a business decision.
Well, and that kind of leads into another question that I've got. You talked about this being a medical drug. Why is it taxed at a different rate than other prescriptions?
Because it's not covered by insurance, and we're trying to make it self-sustaining. We're trying to make the program not drain the general fund, and to make sure that everything goes back into the program, that there'll be money to do the research. So naysayers like West Kitchens can
We've had our conversations.
So they can have the Southern research, and the UABs do research on it to find, because there's not funding out there.
Well, and going on to the funding side of things, and I don't have a way, I don't see where this was a handout, but it says we're going back to Colorado, that it was only 0.9% of the Colorado budget. And again, I don't have where that has been referenced, so I don't know for sure on that. But my question goes though, along those lines.
I hate to interrupt you there, but we are in line with other states that just have medical for the tax rate. We are in line with that. So I'm sorry.
Well, so my question goes back though, when we have this statistic from Colorado, are the dispensaries, are they able to deposit funds in the bank? Because banks are federally insured. Colorado, they can't. Can they in Alabama? If they can't deposit money in the banks, then how are we even sure that we're going to be getting the tax revenue that said that we're going to be getting from this? Is it just an honor system at that point?
Pretty much, but there will be an audited availability for the revenue department or the finance department, but there will not be, as far as banking, I can't tell you how they're going around it in other states, but they are going around it, and they're looking to ease that. And currently it's not being eased, is my understanding.
I mean, it's a cash business in most other states, and I would assume that it would have to be similar to that here, since it is a federally controlled substance. So I think that does it for the questions right now. I've got a couple of amendments that I would like to offer. The first amendment that I have, if you'll look, the top number, it's at page 2 in your packet, 213091-1. And what this amendment does, though, is it couple of things on there, the second page right there. It limits the THC concentration to no greater than 10%. And then also in page 11, line 1, after the non-sugar coated, it also adds, insert the following unflavored. So non-sugar coated, but then also unflavored as well.
Yeah, that amendment was tried in the Senate as well. It's a very bitter component. And so we did not put the unflavored, because sometimes if you have somebody that's suffering from emetic episodes from chemotherapy or something, the last thing you want to do is put something in their mouth that makes them have even a gag reflex or throw up more. So there needs to be some flavor component. We took out the sugar coated up there. I think the flavoring, personally, I think it needs to stay, simply for the reason that it's not a palatable taste. The 10%, that's fine, but it depends on your mechanism. You got a transdermal patch that's in there, and that's based on a concentration gradient. So if I only got 10% in that transdermal patch, it might not be enough concentrated to get it through the skin into the family. Sometimes you get through the skin through ionophoresis, where you use electrical charge and it drives it through. This isn't one of those. This is simply a transdermal concentration gradient. And I think that's probably why that's not a good amendment. But Mr. Chairman, that's up to your committee whether to vote it up or down, but I think that's not a friendly amendment.
Well, I would like to offer this amendment.
Representative Kitchens, would you be willing to separate these two, or is it two separate amendments?
Yeah, I'd be willing to do that if that would work. And could we do that, I guess, tomorrow?
Oh, if we could, I don't know how quick we can work today. Can we do it appropriately so we can, in the morning, put it all in? Well, I don't guess it matters as long as we do it,
Take the top.
take the top one
Mm.
today, because what I want to do is in the morning, if we get it to that point, which looks like we're going that direction, I want to bring it as one sub.
I can run upstairs right now and draft a few amendments. That would be preferable right now. It'll take me about 15 minutes.
Okay.
And I don't have drafting capabilities
Down here.
Yeah, but I can run upstairs tomorrow and do it real quick.
Well, Mr. Chairman, if we're having a sub that we're going to be putting these into, could we potentially just have that included into the sub without it being an amendment?
No.
Mr. Chairman?
Yeah.
I think your intention today is whatever's voted up to go into the sub.
That's right.
Right.
Mr. Chairman, I appreciate you letting me interrupt you there, but if you're going to break it down, do you not need to vote on them now separately? And I would hope you would just table them both, because the unflavored, again, is not going to work in a certain situation, nor is the concentration gradient. I mean, I don't, 10% should be fine for a lot of them. Just a blanket 10% might be difficult. I would almost like the commission to determine, with their pharmacists on board input, determine that, but it's your chairman. I mean, you're the chairman, sir, but.
Representative Kitchens, what would you like to do?
Well, let me mention this as a possible amendment. Instead of going from unflavored to amending it to just one flavor, where there's not multiple flavors or multiple things on there, would that potentially?
Do we need to vote on what flavor? I'm partial to cherry. You're great, but you know.
I'm good with that. Now you're the one bringing the amendment. Now, how do we go about, since we may not have the capabilities of doing this, can we write these out and vote on them? We've gotten into that before and kind of gotten into a tight. Can we take these amendments today with a number and it be all appropriate? Well, we already have those. But for instance, on this amendment, it has non-sugar coated. You're wanting to change it to
Non-sugar coated is already in there, and it's just adding, insert the following after non-sugar coated unflavored. And then the top part of the amendment is where it deals with the 10% concentration.
Are you going to change it to a flavor, one flavor?
Yes, I'd like to do one flavor, and then on the top portion have well, we can split those amendments up if we. I'm okay with splitting those amendments up if we need to do that.
What I would suggest is that you cross out the second portion altogether. Don't get into the unflavored here. And I can come up with some language if you give me about 5 minutes and I can read it to you all. It would actually go to another section of the bill which has to do with processing of these products. And that's where it goes into a whole lot of detail about the packaging, the labeling, the not being attractive to children, all of that. And I can put in there that the commission shall establish one universal flavor to be used for all.
And I'm fine with that. And so if that's permissible,
that's fine.
We'll cross the bottom part out for now, which is the page 11, line 1, and then
5 minutes and I can give you something.
Okay.
That's right. Okay, so we have on the table the First Amendment that includes what we just spoke about with the THC concentration no greater than 10%.
Yeah, on page 10, line 21.
Okay, Representative Warren.
Thank you, Mr. Chairman. Senator Milton, you said that the 10% will not be beneficial to the person. It's too low of a percentage.
No, what I said was that in certain situations, you need to be above that level. And that would be nice to have the option, you know, have a way that in certain delivery systems, if you need it to be higher, you could be. But look, I can live with it. I mean, I'm not going to you know, and we'll figure out something. I mean,
Representative Bolivar.
My question is, when you say 10%, you're talking about as it's manufactured in a particular pill form or whatever. Is that what you're saying? Or each patch is 10%?
You talking to me, sir? I thought you were talking to
Representative Kitchens.
Yeah.
Well, it's the 10% concentration level of the THC in the product,
All right, but not in the person.
not in the person, in the product.
So my question for Senator Melson is instead of giving one dose, you give two. Would that accomplish the same thing?
And those situations, yes, but again, if it's transdermal, you have to leave it on there for, you know, whatever length of time. Most of them are around 3 days, some of them longer, some of them shorter. Let's say you had a patient that had this difficult swallowing and they couldn't take it orally or whatever, and they wanted to go with the transdermal route, you would need you could probably get by with a larger volume spread out over a larger area, but in general, you'd want to keep it confined to a smaller area. But again, it's if this, since this will make Representative Kitchens vote for the bill, I think I'll be glad to take it. However,
and well, the next question for Representative Kitchens, what was the purpose?
What was the purpose of this? Just limiting the total amount. And this was a recommendation from the Attorney General's office.
I understand.
Okay. So we're going to put that on hold while this is being written and come back to it. Now let's have the discussion about the non-sugar coated.
Can I say one thing real quick? I'm sorry. I guess somebody listening said that California and other states have passed a safe harbor law for banks to be able to work in that industry. So we might need to look at passing a safe harbor law for banks.
We'll do that on the floor. If you're talking about it.
We'll do that next year.
Yeah, next year.
If we get there.
Okay, any comments? And we'll come back to these two and vote because of the way we're doing it. Yes, ma'am. Representative Meadows.
I wanted to comment about the flavored, unflavored, and my understanding is the non-sugar coated is already in the bill.
That's correct.
But we're talking about we can have pills that are, you know, the kind that break apart, possibly.
Or gelatin.
Or gelatin, or hard pills, or transdermal patches, possibly liquid.
Yes.
So no offense, but how many children do you have?
I don't have any children.
Okay, so I have 3 that are all grown, and different types of medicine or come in different forms. I would not want to try to give anybody, but particularly somebody who's sick, something that doesn't have any flavor. I have to agree with Senator Melson on that. It could make them gag. And I've seen it happen. And that defeats the purpose of giving medicine. Whether it's a pill, whether it's liquid, I'm just saying it's
my only argument to that is that there are plenty of things in here on ways to distribute this and to administer this. So even if it's not an edible, you know, when you do see edibles more in the recreational that we spoke about earlier in the distribution, when it becomes more of a candy type setting and it becomes more attractive to children or flavorful to children, where they would almost want that similar to whatever hard candy you have.
But it had a horrible taste, and my son learned to love it for some reason. But the point is, if we're going to have a bill, then we want it to be able to.
Speak into your mic, please.
I think the point I'm trying to make is that if we're going to have a bill that allows for cannabis to be used in medical purposes, that we want it to be useful and not something that the patient can't tolerate. And I appreciate your amendment, but I'm going to be opposed to that for that reason.
Okay, any other comments on that amendment? We will come back to both of those individually. Yes, sir. Representative Lipscomb.
Representative Kitchens, I think that when you and I were having that side discussion, that the good compromise here is to have the singular flavor. I think having the flavoring deals with the senators and with Representative Meadows' concern about the intolerance of the taste, but keeping it to a singular flavor de-incentivizes that candy issue that what you're talking about. So it seems to me that's a good compromise.
Okay, are we ready for that, or are we what? Be a few minutes.
He's going to actually print something out for us.
Okay.
I think it's better to have a piece of
Written.
paper for it.
Okay, we'll come back to that as soon as the paperwork.
I have
comes.
another amendment.
Okay, we'll bring it on.
Do I need to table this one right now or temporarily, or what do I just move on?
Well, there was no motion. You just spoke about it, then we'll come back to it.
Okay. All right. On page 6 of the packet, and we heard from a few speakers today, page 6, this deals with driving under the influence. And so on page 21, line 16, after law, this is really just saying that you can't have THC in your system. It can't be present in the individual body, whether the individual holds a card or not. You can't be in control of a vehicle while you have that in your system.
Okay, so you're just going to ruin the CBD industry, which has a lower THC, but will have it in their body as well? Is that what you're trying to do here? Or well, CBD has THC in it, and this says if you have any THC, you're breaking the law, which now you've just not only hurt this bill, but you hurt the CBD industry in the state, if I'm not mistaken. So that's probably something you need to think about. But I will say this, the Department of Labor does a study every year, and they do expected workforce deaths. So if they're in a certain industry, they have a certain number of deaths they expect every year in that field. States that have medical cannabis has shown to drop over 10%. And the reason being is people are not going out to their car, getting their alcohol and popping their pills at work. So also workman's comp claims have dropped almost 20% in states that have medical cannabis. Because people are doing the same thing. They're not taking their illegal drugs, or well, maybe they're not illegal. Maybe they have a prescription, but they're not the best choice at work, or they're not going out and drinking their vodka, I guess, since that is odorless, I hear. So don't think of these people as being catatonic, sitting at home, not being able to function. Other states have these individuals, and I know of none that say that if you have a THC level, that you're not allowed to drive at all. I don't know if this is a poison pill from the AG's office, or if it's just
my concern, and I've talked to you about my concern on this, is that being able to test someone, in a DUI, you have a breathalyzer, and marijuana, and you have said they are working on test, but you have a positive or a negative test, and you can't determine whether someone is under the influence, and it might have been an hour ago, a week ago, possibly even a month ago.
There's a study came out in New Zealand that says almost after 4 hours, most people with recreational are back to normal as far as their ability to make decisions and reaction time. I'm not using that to say that's in play here, but I'm just saying, yes, your concentration lasts a lot longer than your impairment. But again, as law enforcement says, impairment is a judgment call. You can be impaired and not have a level of any significance, or you can be impaired from other things. So impairment's a judgment, not a level, and again, we're talking medical, not recreational. And I haven't known any state that's suspended license just because you get a card and go this route. I'd be more worried about Valiums, Annex, alcohol. We say you can drive up into, I assume it's 0.8, right? Is that correct?
I believe so.
I don't know. I've never been checked or pulled over, and nor do I drink and drive. But, there's a lot other things that I'd have concern about that people take.
And that goes back to when you do test over the 0.8, the legal limit, there is a more definitive test than we have for THC.
And they're getting more and more. I know Draeger out of Germany and Abbott out of Chicago is coming up with some saliva tests and some other tests that are supposedly going to be more accurate. And as we see this increase and expand, the market will drive to have law enforcement more instruments to detect it. So, I mean, I just, it's your committee, sir, but I think that's a bad amendment.
Okay.
Still love you, Wes.
Any other comments about that amendment? To move forward, I need a motion and a second. Okay, the amendment fails for lack of motion. All right. two other amendments in here.
I have.
Representative Kitchens, are you handling those?
I have them, sir.
Oh, okay, Representative Mooney.
I have some questions for Senator Melson prior to offering the amendments. Senator Melson, I would never argue with you about anything medical because you are a doctor and you do research and you're extremely knowledgeable and know the type of phraseology and use of wording to certainly support your positions. I would ask you just a couple of questions that concern me in the process of looking at what we're talking about. You know, there are hundreds of chemicals in natural marijuana. There are all kinds of chemicals. I think, even though I'm not a researcher, I can read that and see it. There are high risks of drug interactions, that type thing. What protocols do we have in place in this for dealing with adverse reactions of that type?
Well, I got a list of over, I can't remember how many hundreds of drugs that has potential interaction from a pharmacy association. And that's why we'll be opening the database for them to check and educate the patient.
Then why would we not involve pharmacists immediately?
Because of their license is just like the physician can't prescribe, he can only recommend cannabis. And so the same thing here. Pharmacists can't, it's a Schedule I.
Well, we're good friends, and you know that my position is that this is something that should be done through medical science with our universities, with our doctors, our pharmacists, and in the manner that we did Carly's Law. However, I would just ask you, knowing that hospitals are having massive costs in relation to their emergency rooms with visits, and there are studies clearly that show that they're losing millions of dollars in relation to marijuana visits to the hospitals. You know, this process doesn't seem to address how do we solve that issue. Likewise, I know we keep talking about recreational versus, you know, the studies that are showing that this and that, and then we talk about recreational. The one thing I do realize is we talk a lot about Colorado, and I recently was seeing information about Colorado that clearly showed that opiate use and deaths were already rising before recreational marijuana came in place. I think that's something that's worth us knowing. And I mean, that's factually provided in studies.
You said deaths?
Sir?
I'm sorry, you said, I just want to make sure I understood. You said deaths, right?
Yes, that deaths were even rising. I'll be glad to supply you with the study.
If you look at that, Representative Mooney, you'll see that probably that was also about the incidence of the time that the fentanyl came in. And the therapeutic index, oh, yes, it is. We can shake our head, but it is. Fentanyl is, I've probably given gallons and more fentanyl than most people. And
there's no question that a lot of marijuana gets laced with fentanyl. I agree with you on that. That's an issue.
Well, not just that, but it's just getting used straight up.
Yeah. Oh, you're correct. It does get used straight up. In the process of looking at this, you know, does it not bother you that 8,000 members of the Fraternal Order of Police with meetings specifically legislatively committed from their local chapters come together in our state with the national organization, and they all oppose this process? Those people who would actually police our roadways, who would try to help us with the process of keeping our roads safe. No, I mean, I have a reputation, obviously, of supporting MAD. There's no question. I believe in interlock and the interdiction process.
Me too.
Trying to get somebody help before they get to the point they hurt someone. Our state is in the business of alcohol already. I think it's probably fairly well known that you have a friend in the Senate, and I support him in his concept of getting us out of the alcohol business because people get killed because of the use of it. And at the same time, that's what I'm hearing from this type of thing from the Fraternal Order of Police, that they are concerned about the number of people who will die from misuse of the product. I just really
can I say one thing that
Representative friend, that the whole concept of our state getting in the business of the selling process of a product along with the one we've had with alcohol that is going to hurt people and possibly kill people on our roads is very concerning. I just share it as my comment. And you know that.
And can I respond to that comment?
You go right ahead.
I was just going to say that, yes, you're right. That is their stance. And the same ones that are members have called me up and said, I can't publicly support this, but I have a kid with autism and I'd like for him to try it. I have the same one that said, my wife, and you have two in your body that can tell you stories about their spouse who had cancer and couldn't get any relief.
Sure.
And they took it. So why would we want those individuals to go to a place where they might get that laced with pesticides or some other product or fentanyl in an illegal setting when we can set it up where they get it where it's purified and known quantity and have access to that? That would be my argument about the situation. I get it. I understand where law enforcement's come from. I tried to meet with the chief state law enforcement officer for 3 years. He's brought amendments through other individuals. He hasn't called my office or returned my call. I wanted to work with Aaliyah. I wanted to work with anything.
On that.
Yeah. I mean, I have tried to reach out to every law enforcement to say, what can we do to make this better? What can we do to make it where it's in the patient's hand and not in the criminal's hand or the abusers? I have reached out and tried to cover every base. But if you want to reach out to somebody, they got to reach back.
Representative Mooney, you have two amendments.
I do have two. One other comment just to make. Certainly you understand that my comments are not directed to you in any negative way. We've discussed many topics many times. We share fraternal opportunities as friends and organizations and different things. I'm very
respect you, brother.
concerned overall about the whole process of our state getting involved in another product that could kill people on our highways. I have two amendments that I would offer. The first is 213090-2. It's in the packet. I believe it is on the next second to last page. And it would, beginning on page 39, line 13, and continuing through page 40, line 2, delete all the language and insert in lieu there, in lieu thereof the following: tetrahydrocarbon, I never can say this right, tetrahydrocannabinol. It would be inclusive of putting everything together that falls into that category. It would just, it changed the Delta 9 to be just one thing that covers all forms of cannabis so that it's uniform with respect to dosages. And I'd move to include that, or excuse me, I'd move to approve that favorably.
Can you explain that amendment to me, sir?
Just simply what I said. The best way I can put it is it would be an inclusive process of having all of the products under one umbrella, that being the umbrella of tetrahydrocannabinol, instead of separating it out as Delta 9 tetrahydrocannabinol. It would put them all together under any tetrahydrocannabinol.
I guess I'll be the dummy and ask, explain to me what that is. I don't understand that.
It is a product in the marijuana, and we've separated out to say just a Delta 9. And what I'm proposing from the Attorney General is a inclusive process of all tetrahydrocannabinols. This is the product that was referenced in Senator Melson's bill as a single Delta 9. And this proposal would be to make it inclusive of all tetrahydrocannabinols.
I'm not sure that I understand the purpose of that.
I think it's pretty clear that, just as I understand it, that it would just be a catch-all for all of the related tetrahydrocannabinols.
Well,
and I'm not a scientific brain on that process. I certainly can't give you detailed medical information on it. It's from our Attorney General, and the importance of that to them is, that it would be inclusive of all of them, that we not miss, like we've gone with some of these products we've just made illegal with the new things that have come on the market and we're seeing through the convenience stores and stuff. This is trying to make it more inclusive for all of it.
And
Representative and Senator, I was just consulting with Paula with LRS, and I'm going to allow her to make some comments because she's been involved in this from the beginning, if you don't mind.
No, we're
And
talking,
use your
we're talking about a specific amendment here, correct?
Representative Mooney.
Okay.
Yes, it's a specific amendment.
Okay, so what that amendment says is, where's that amendment?
Right here.
Okay,
It would come from line 13 all the way through line
exactly.
2 on page
Thank
20.
you. And so if you look at line 13 of the bill, it starts out with the word delta 9 tetrahydrocannabinol, provided, however, the maximum. That's what it says. You're replacing it with the word tetrahydrocannabinol. So you're taking out delta 9 in the amendment. So I think that takes care of your concern. You're putting all THC into the daily dosage of all types of THC. So delta 9 and any other THC in there. So I think that that's what the AG had asked for, and that's what is in this amendment.
And my question is that, and you can help me here, does that not make it where all of a sudden CBD requires, it would become medical as well and require them to fall under that same line?
So this isn't addressing CBD, only THC. There's no maximum daily dosage for CBD.
I understand that, but THC is all in CBD as well. So I didn't know how that affects it or not. I'd like to table this and let's talk about it. And because nothing disrespectful. I just, again, I've reached out and now I'm getting amendments thrown at me from an individual who has not reached out to me. And I don't know the point or the thought process. But again, Mr. Chairman, it's your committee.
Well, I don't understand it, and I like to know myself. I may be for it. I just need a little time myself on it too. But I need to have a motion for Representative Lipscomb, a second for Representative Soros for tabling. Are there any other comments or any input that can help in any way with this from committee members? Representative Meadows.
It seems to me like by accepting this amendment, we would be somewhat tying the hands of the physician who has already gone through the process, paid the fee, and gotten the patients to the point where they are ready to start trying cannabis, THC, Delta 9, whatever we want to call it. And I guess I would be, if we're going to have a bill that allows, and again, I have not decided to vote yes, but if we do have a bill that we're going to allow medical cannabis or medical marijuana, then I want to make sure that it's a bill that will work for the patient. And this does tie the hands of the doctor to a 50 milligrams. And some patients, that may be a drop in the bucket, whereas other patients, every patient responds differently to medicines.
Okay. We have a motion and a second to table the amendment. All those in favor for tabling the amendment by saying aye. Aye. Those against, nay.
Nay.
The tabling motion passes.
Do you want the second amendment?
Yes, sir.
The second amendment, let's see. I believe it's back further up in the packet we had passed out. In any case, it's 21-3092-1. And it is towards the front. It's the third amendment in the packet. This was an amendment that would limit the number of, this is an amendment that would limit the number of conditions that are covered to those that are listed here: cancer-related, so forth and so on, epilepsy, so forth and so on, HIV, AIDS, so forth and so on, spasticity, so forth and so on, spasticity associated with multiple sclerosis, so on, and a terminal illness. I'd move approval of the amendment.
So let's go back. Tell me with the
It
bill
would
that
be eliminating anxiety,
That's what I
autism
wanna know.
spectrum disorder, Crohn's disease, fibromyalgia, PTSD, sleep disorders, Tourette syndrome, and chronic pain.
Representative Mooney, can you name those again slowly?
Sure. it would be eliminating, gosh, just had it in front of me. It'd be eliminating anxiety, autism spectrum disorder, Crohn's disease, fibromyalgia, PTSD, sleep disorders, Tourette's syndrome, and chronic pain, pulling it into those that would be left 6: cancer-related nausea, weight loss and chronic pain, epilepsy, HIV/AIDS, motor neuron disease, and multiple sclerosis and terminal illness.
Any comments by the sponsor?
Yeah, I mean, I'd like to hear the reason why we took off each one that we took off. I mean, it's, you know, you had your Judiciary Committee add to, Parkinsonism was wanted to be added by Representative Faulkner. And then another member added another one. But the point is, you know, here we took off anxiety. We took that off because I heard that was, gave heartburn. And then pretty much everything else, I mean, there's literature to back it. So I don't know, you know, the origin of picking and choosing winners and losers. I guess it depends if your family has it or not. But
Representative Hall, did you? Okay, we have a motion for tabling by Representative Hall, second by Representative Gray. All those in favor of tabling this motion by saying aye.
Aye.
Those against, nay.
Nay.
Okay, tabling motion passes. Y'all making me earn my money today. See. All right, Representative Meadows, let's go back to your amendment since that failed.
Mr. Chairman, I have a somewhat similar amendment, but on page 13, I would just request that we delete lines 6 and 8, and that means we would delete being able to use this for fibromyalgia or menopause or premenstrual syndrome. I have not had fibromyalgia, but actually no.
I can't hear you.
Yeah,
I'm sorry. I've not had fibromyalgia, but I do know plenty of people who do, and it is a dreadful disease or a dreadful problem, but it's not a disease that has a test that can be used to determine if you have it. Most of the problem with fibromyalgia would come underneath, would be considered chronic pain, or maybe underneath number Q, which is a condition causing chronic or intractable pain, blah, blah, blah. And the menopause or premenstrual syndrome, I have a daughter. Between the two of us, we've been through both of those issues. I don't view that menopause or PMS is a reason for someone to be going through all this massive drug process. PMS is a timing situation. It lasts for a few days. Menopause lasts longer, but it's certainly not something that you would want to get into a regimen of medical marijuana use. And there are plenty of other drugs that treat the symptoms. And there's also, well.
Okay.
Mr. Chairman, I would say that she's correct that fibromyalgia is kind of a diagnosis of exclusion. And I'm fine with that amendment.
Any comments before I'm looking for a motion for a first and a second on this one. Yes,
A comment.
Representative Marcus.
Dr. Melson,
yes, sir.
The fibromyalgia, what Representative Meadows was saying is there may be, if someone does experience that or have that diagnosis, under the current bill, if that was taken out, they would have other means of getting a treatment of medical marijuana if passed. Is that what I'm hearing?
I would say that they might be able to get in another way, but I would say also that we want to limit the ability to flip a diagnosis to find a way to get the patient something. So I don't want them to have the actual diagnosis they're getting treated for before they qualify. That makes sense?
Yes. So you're good with the.
I don't have fibromyalgia.
Yes, sir.
But the patients who have fibromyalgia frequently Dr. Hop, because most people are treated at more as a mental illness than an actual physical illness, and those people have a difficult time. Having worked in a pain center for several years while I practiced anesthesia, you do trigger points injection and you expect them to not be able to take a drink without water coming out because they get so many of them. And so these people actually get pretty desperate, but I'm good with accepting this amendment. We'll just.
Okay, I have
deal
a
with it.
motion first by Representative Oliver. I hear a second. Representative Marcus, second. All those in favor by saying aye. Aye. All those against, nay. Okay. So I guess we'll do a roll call vote. If you're in favor of this amendment, your vote is aye. If you're against, it's nay.
Representative Lee.
Aye.
Representative Oliver. Representative Hall.
No.
Representative Lovern. Representative Sorrells. Representative Gray.
No.
Representative Lipscomb. Representative Kitchens. Representative Marcus. Representative Mooney.
Aye.
Representative Meadows.
Aye.
Representative Stadhagen.
Aye.
Representative Rafferty.
No.
Representative Sells. Representative Warren.
Okay, amendment passes. All right, now we're going to go back to the amendment of Representative Kitchens. And you just brought it to me, but I have so many stacks here, I have no idea where it is.
Well, I'll explain this. So the first amendment that she brought back had both of these in here, and then we have two amendments now that are separate. So I'll offer these as two separate amendments. The first amendment that I'll offer is on page 10, line 21 after product. That's where we insert the following, dealing with the THC of the concentration no greater than 10%.
All right, you've heard the motion. We've discussed it in length. Do I hear a motion by Representative Mooney? Do I see a second? Second by Representative Oliver. All those in favor by saying aye.
Aye.
All those against, nay.
Nay.
Okay, no need for a roll call vote there. All right, Representative Kitchen, second amendment.
Y'all have been harsh on me today. All right, this splits it up, and this was a little bit different than the first amendment that we had on page 76 after line 21. What this is going to do is this is going to allow the commission to establish the universal flavor of all basically oral applications, so the cubes, lozenges, and everything. So it would allow them to establish one universal flavor for everything.
Okay, need a motion if we determine to pass this. A motion, Representative Meadows, are you making a motion? Motion for approval, second by Representative Lipscomb. All those in favor by saying aye. Aye. Those against, nay. Let's do that one more time. All those in favor by saying aye.
Aye.
Those against? Ayes pass.
Representative
Thank you.
Lipscomb, you can put in
Committee.
sweet potato for the flavor.
Okay. Are there any other amendments? Yes, Representative Session.
Just one quick one. Thank you, Mr. Chairman. On page 20, Senator, on line D, you have in there about hospitals, medical facilities, and hospice programs. Basically given immunity. What I'd wanted to consider was the possibility of inserting assisted living facilities also in that, because there are certain situations where they will be administering medications, and that way that we would have them covered also under that.
Sounds fine to me.
Okay, then let me tell you where we are here. We do not have amendments written up, nor do we have the capabilities of doing that. That sounds as though that's very palatable. If you guys are good with that, what we will do, Paula, is add that into the substitute. This is that okay with? Well, I don't even know if we should do a motion unless somebody's against that. Do that.
It's just a matter of adding assisted livings as one of the facilities that fall up under category D on page 20.
Okay. Should we do a motion on that? Representative Hall, you've been here? Okay, well, let's do a motion. We got a motion from Representative Marcus, second by Representative Sales. All those in favor by saying aye. Aye. Those against, nay. So we will add that into the combined amendments that will go into a substitute. Also, I mentioned earlier about the cameras, as far as being in the dispensary for 24/7. I would make that suggestion. I need a motion by Representative Mooney, second by Hall. All those in favor by saying aye.
Aye.
Those against? Okay. Does anyone else have any questions before we leave? Representative Warren.
It's not a question. It's a personal comment that I wanted to make. And I think so often we bring bills before us that we really don't know anything about, and we try to deal with it, but we keep talking hypothetical in so many situations as legislators. And I think that in this particular instance, I have to talk reality when I talk about the medical marijuana. And some of you have heard me say this. I've had one of my friends whose grandfather, grandmother, and mother suffered from cancer. And I couldn't figure out what was going on when I went to visit the people until later on. I asked her, how was it so easy for her to manage her sickness? And she simply told me, she said, I gave them a tea at least 3 times a day. I said, what kind of tea? She said, I gave them marijuana tea, and she mixed it with honey. And I saw what had happened in that situation. Then I had to sit up and I had to witness my mama die from cancer. If you have not had that experience in your life, you have no idea anything that could have relieved my mother's pain other than morphine. When you're in the hospital dying with cancer, they put you on morphine. And here we're talking about marijuana. Something this is this simple. I mean, the morphine keeps them knocked out. They have no appetite. It's just a live death that you have to sit and witness with your loved ones. So I just want to compliment you and say thank you for giving a real option to people who suffer. And like I said, when she gave her grandparents that, they were calm. One lady, her grandmother was making jokes 1 hour and was dead the next hour. So, I mean, we got to get real and talk about what these effects really can do for people who are suffering. And again, I just want to say thank you, and let's keep it real. Let's stop trying to invent circumstances and situations. Let's deal with the reality of what's happening with many of our family members. Thank you.
Senator Melton, I was looking over my notes, and I did not mention earlier, as I was speaking about the employers and the safety net that is included in this for employers, that several here fall into that category. Would you address quickly the workman's comp, going through that process? And then, my question is, can I, as an employer, when I'm doing an interview, ask them, are they on medical marijuana? And then I think the response by someone was, when you do a drug test, you'll find out they are, and that's when you ask.
Yes, I'll be glad to address
Please
that.
do. A lot of people are interested in that.
I met 2 years ago with BCA, Manufacturer Alabama, the trial lawyers, to make sure that we not only protect the employers, but the employees. The employee will have to, when he gets a card, notify his employer. That's still in there. And then also he can terminate him. He can say, we can't have anybody with cannabis working for us. He can terminate him. He doesn't have to, but he has that option and he's protected. As far as workman's comp claim, somebody wanted to say no workman's comp claim. Well, I didn't think that was exactly fair. But if an individual gets injured on the job and it's his fault or his negligence, or it's, it's just him, he can't make a workman's comp claim. However, if some other employee, like driving a forklift, doesn't see him and pins him against the wall, he's covered. So it's related to his fault or not his fault on the claim. But that was a compromise that, I sit down with George Clark and the other people that also, well, it doesn't matter who, BCA and trial lawyers, and we worked hard, and they all agree that they are pleased with the way the bill's written. It protects the employer. Started out based on Ohio, which has the best as far as protecting it, and we even increased the protection. So, can I say one other thing?
Yes, sir.
I appreciate every one of you members taking the time to look at this bill, even the devil's advocates, because I appreciate that. I like to play devil advocate myself a lot, because that you learn a lot from people being against something. You find out what they're against and how you can make it better. So I really do appreciate Representative Mooney and Representative Kitchens for coming with those situations. I didn't just take them lightly and want to blow them off. You got them to me yesterday, and anyway, thank y'all for trying to make this bill better, whether it passes or fails and tomorrow or on the floor if it gets there. Thank y'all for all listening and being patient and working with me.
Good. All right, just to remind everyone, we're going to take these amendments that's been added. We're going to put those into a substitute, including the two that we did not have paperwork for, that we voted on. Those will be added to a substitute, and we will walk in, and I prefer not to change it. If we've got any changes, I want to do it today. We'll stay here till midnight. But that's the flow that I've talked to each one of you about. If we have any changes, we need to do it now. I don't really want to do it in the morning as the chairman of the committee, because I've got to keep it at least controllable. So, yes, ma'am. Representative Meadows.
Will we be able to get a copy of the thing before tomorrow morning?
Well, I would say absolutely. She's the one doing it. She will do everything she can to get it to you.
I should be able to get you one by later today. Good job.
Okay.
Mr. Chairman.
Yeah, yes, sir, Representative.
Will it be kind of blue lined or whatever, the way we had the last one where we could easily pick it up?
If you prefer, I can give you two documents again. One is a compare document.
It's just a document that's long. It's so much easier.
One will be a clean and one will outline the changes. Absolutely. Good
Keeping order
question.
and keeping our committee on track.
Yep. Paula, comment.
Okay, in addition to the, I believe, 5 amendments that I will incorporate into the substitute, there were 2 additional changes that I believe came out of this committee. One was from you, Representative Lee, to add cameras at dispensaries 24/7, certain day of recording. And the second was to add assisted living nursing homes, so whatever the right wording is to that line about immunity. So just want to clarify that too will be put into the substitute.
Okay, very good. Tomorrow.
But do we need to pass the sub as amended? She's a no be tomorrow. We can just table everything.
Okay. All right, we're trying to do this is a little different than normal, going through 2 committees. So we're trying to make sure our I's are dotted and T's are crossed. Guys, thank y'all. Thank everyone for coming.
Mr. Chairman,
Yeah.
I'm not going to, I don't think I'm going to be able to be here tomorrow because I have a death in the family. I'll probably be out of town, but I want to make it publicly known that I support this bill.
Okay. All right, that concludes our meeting. Thank you.
Good job, Mr. Chairman. Paul, you had your hand.